There is what we call like a One Health approach, which like it should actually be adopted, like in South Africa. And I think in South Africa, what I've observed is that every department which has deals with health, whether it's animal health, veterinary health, animal science, like deals with animal health, like where like you're dealing with the public health we were all work in silos, and like we saw the problem during the time of COVID, or the time maybe we will see it like in the time where maybe there's an outbreak of listeria, where like there's no one health approach. Every expert like obviously will have a different opinion because they do not work as one in order for them to actually target an organism which is their it will be the enemy at that time. So I think to achieve a balance between public health and market stability too, and food security in South Africa, we need to adopt a more integrated and proactive approach to biosecurity. I think this will include obviously like that will harmonize the policy with the global standards, which will have to align with the former um, um, Office des Epizoites, OIE, like which is the World Health Organization of Animal Health now, and World Trade Organization and phytosanitary guidelines, as well as the Codex Alimentarius standards, as well as um, phytosanitary standards, which is the I just for ISPMs, yeah, to ensure the transparent and scientific based trade decisions to gain that international trust and market access. So that has to be robust because now, like with Darrell also having moved that function to Border Management Authority, it's also a problem because now they're working away from scientists, but like the biosecurity now is handled like at the borders, is handled at the borders and at the airports. Like it's handled by the Border Management Authority. Then they report to the Department of Agriculture, which is also a biggest problem. Like when these decisions are made, aspects expecting the fields they are not called, so they just make these decisions politically. So I think also the early detection and of the rapid response systems to strengthen the veterinary services and to detect and contain the outbreaks before they disrupt the trade or the food supply will also help, and to ensure that the disease control doesn't rely solely on the bans, and like we can actually use scientific methods in order for us to do this, and which like now in essence it punishes the markets rather than to prevent the risk. And the local thing vaccination production will also have to be considered to also partner with the public and private partnerships and to facilitate also the shared investment on biosecurity infrastructure, such as laboratories, traceable tools, and surveillance networks, like where we can actually make sure that we speak out if maybe there's an outbreak in a certain area.